Hello, I'm Dr. Gamond. We now have an increased ability to evaluate cost, efficiency, and outcomes for various aspects of patient care. Providence has a new ability to meld cost with outcomes in the value-oriented architecture platform with a new cost accounting data that better articulates the cost of care in the acute setting. One of the procedures we investigated was laparoscopic cholecystectomy. In analyzing this procedure at the various hospitals in the Oregon region, Providence identified that some hospitals were performing a laparoscopic cholecystectomy at a very low cost, while others incurred a very high cost to performing the same procedure. You will see in the upper right-hand quadrant of the graph that most of the facilities are in this area. This is the desired area. This means that we are able to perform the procedure efficiently and with good outcome, and that the patient has an expected or shorter than expected length of stay in the hospital. If you look in the opposite quadrant of the graph, the bottom left quadrant, that means that the procedure is being performed at a higher cost and with a higher length of stay. I know this because PPMC, which is the facility that I work at, is the highlighted facility in that area. Providence asked me to investigate why my facility had a higher cost and had a higher length of stay, and asked what I could do better to align my facility cost with the outcomes of the other facilities in the upper right-hand quadrant of the graph. There was a lot of discussion about various ways to approach this, from individual surgeons' technique, to how the procedure is set up and performed within the facility, to other reasons. We found that there was a lot of redundancy and waste in how the procedure was being set up within the facility before the surgeon or patient even reached the operating room. This slide looks specifically at supply related to the same cost per case and length of stay outcomes. See again how one facility is different than the others in the bottom left corner, meaning that the supply costs were actually significantly driving this difference in cost per case compared to the other facilities? We scrutinized every portion of this procedure setup. We realized if we removed much of the redundancy and excess, that it would be unlikely to be noticed in the operating room by the surgeons performing the procedure, but would actually be noticed as being simpler and more straightforward to the surgical tech and nursing staff, while also reducing costs. We created a new pack and performed a pilot study at PPMC using this pack. We gathered input from the surgeons, techs, nurses, supply staff, and core staff. The results were overwhelmingly positive that this new pack was simpler to use, well received by the techs, nurses, and staff. The surgeons' cards were cleaned up and reprinted using the new pack, which decreased the size of the card from 5 pages to 1.5 pages. The nurses and techs commented that the case was more relaxing and less stressful because they did not have to read the cards to each other and all the pages of additional redundant material they had accumulated on the cards over many years. In this slide, you can see the decrease in supply costs as a result of this supply study. In 2018, supply cost for each case was $482, which decreased to $389 per case in 2020, almost $100 per case. We then rolled this pack out at St. Vincent Hospital, which also had excellent feedback and led to further refinement of the pack. This savings can be significant, especially when improvement in supply and ease of performing the procedure can happen all across the region. This slide shows estimated savings based on 2019 case numbers. Remember, this is 2020, and COVID has changed our case numbers this year significantly, so we're going to use 2019 as a better, more stable estimate. We highly recommend that each facility revamps the surgeon's cards when they institute this new pack. At the end of this video, there will be a list of contacts and names to contact regarding any questions with the pack, its contents, how to institute it, card reorganization, how to make changes for the specific surgeons, or questions for specific surgeons. Thank you for your time. We appreciate your effort in this process improvement. Lauren will now show details of this pack.
So you're going to open the pack. Just like every pack, there's what's in the pack. Here's your basin. Inside the basin is your normal kidney basin, a couple containers, your med cup, 2 Mayo stand covers, a half drape, utility drapes for squaring off, your normal Ratex. You have your insufflation tubing, towels, a lap Chole pack, which is your normal abdominal drape, and this one does have pouches. Your sharps container, we have our normal, your fog, 11 blade. This pack does only have 1 hypo and 1 syringe. Your light handles. This pack comes with a Varus needle. If a surgeon doesn't want a Varus needle, feel free to throw it off, but it's cheaper to have it in the pack. your laparoscopic cautery cord. The biggest change to this pack is it comes with 3 5mm trocars. So with this project rollout, you're going to have somebody revamp all of the lap Chole cards. That means remove all of the 5 ports from the cards, and then what will remain is what we call the surgeon acceptable variants. This is going to be their gown, their gloves, the sutures they prefer. So if you have any questions about how to change the preference cards, feel free to contact one of us with the information displayed on the screen.
Thank you for your time. We appreciate your effort in this process improvement.